I'm Jenna Cantor, and welcome to Physiotherapy Performance Perspectives, a physical therapy podcast for performing artists. Today, I'm interviewing Dr. Sigrid Scruggs. Welcome.
Hello. Thank you for having me.
It is wonderful to have you. Sigrid founded Theater Arts Physical Therapy in 2002. She is a graduate of Johns Hopkins University with a degree in natural sciences and behavioral biology and earned her doctorate in physical therapy from the University of Southern California. She has utilized her ballet and piano training in combination with her academic background to rehabilitate dancers, instrumentalists, and athletes, including members of the New Jersey Ballet, American Repertory Ballet, Pennsylvania Ballet, Paul Taylor Dance Company, students of American Ballet Theatre, and performers in numerous Broadway shows, including Cats, Lion King, Swings, and 42nd Street. Wow! She has extensive training in manual therapy, injury prevention, and Pilates-based rehabilitation, including the Pilates Teacher Training Course at the Pilates Studio of Los Angeles, and earned the Polstar Pilates Rehabilitation Certificate in 2005. This is a thrill. Today, Sigrid is here to discuss the value of Pilates-based rehabilitation. So let's just dive right in. First question, what is Pilates-based rehabilitation?
Well, Pilates-based rehabilitation incorporates the principles of Pilates into a classical physical therapy restorative program. Joseph Pilates himself, he really started with injured soldiers a long time ago, and the basic principles are simply marvelous for bringing people back to their full health.
Excellent. So why do you think Pilates is important for dancers?
I think Pilates is so important because the movements make sense to a dancer. He allows a little bit of turnout, which most dancers really like, but not the full turnout, but allows them to really work the muscles and the joints in an optimal position. Additionally, because his equipment is very clever at unweighting the body in certain ways, they really can learn how to move more efficiently and to correct some of the faults that are holding them back.
Excellent. So would you mind giving some examples of common dance injuries that are addressed in Pilates-based rehabilitation?
The spine in particular it works so well with the spine because, again, he focuses on symmetry and alignment and core, which a lot of people call the core now. He called the Powerhouse and invented an incredible repertoire of exercises to engage the muscles appropriately with good timing and sequence that is essential for bringing that person with a spine problem back into a good condition. Additionally, hips are wonderful because, particularly lying down on the reformer, you can really focus on how the hip moves. Does one grip? You can try and cue the person to relax in the muscles that are gripping too much, but also to activate the muscles that are not working as well. So it's simply wonderful. Anything that has to do with alignment, Pilates does incredibly well. I just had someone this morning who has a spine fracture. She also has scoliosis. So I know in a previous podcast you were talking about alignment dysfunctions, and this really is the essence of that, a profound alignment problem. And we're going to use a lot of Pilates because it works both sides of the body equally. Because her pelvis was out of alignment, it's a secondary problem going on with her, but we'll be able to work symmetrically the right and left side of the body equally so she can find the proper muscles so that she can support herself well and do the movements equally on both sides of the body.
That's great. So you're really able to individualize what each dancer needs through Pilates.
Absolutely. I am a physical therapist, and so I'm going to do a physical therapy evaluation and look at all of those movement problems and then establish which exercises. Some of them come from Joseph Pilates, and of course I'm also going to select other modalities that we as physical therapists utilize to incorporate it into the program. It's not just one thing or another. We take them and fuse them together to make it even more powerful.
So in your experience, have you found that dancers often have weak or strong Pilates technique when first starting? Why?
If they're meeting me, they usually don't have a strong Pilates technique. If they did, I wouldn't see them most likely because most dancers are overuse injuries. But so they usually are pretty weak in what they call the core. Joe called the powerhouse. And so those muscles are usually, they're having difficulty engaging them. They may actually be strong. They just aren't, they're just taking a nap at certain moments. And that's where, okay, we need to get back to our basics and re-engage our center, our powerhouse, make the connection so that then when they're, let's say pointing the foot, they're only using the foot to do that. Or if they like to grip in the hip, let's get the hip to relax, use the lower abdominals to support so that we don't have to grip in the thigh, which might make the leg be lower than it should be.
Regarding the core, if you're strengthening the core, and you were saying that it can change how they point their feet. For any dancers listening in, would you explain how there's a connection between, working those abdominals and then how that can help their footwork?
Absolutely. The abdominals, when you have the support in the trunk, you don't have to use the feet as much for the lifting. When you have, again, if you have the abdominals and the glutes firing properly, you can use the foot to do a pretty movement. In particular, it's wonderful to take the pressure away from the feet, the people who land heavy in their jumps. So they're using their feet to really push off of the floor. If you have a good trunk control and strength, you're going to use your trunk muscles for the lift off of the floor, and then the foot just merely has to look beautiful up as you're flying through the air.
Yeah, it just simplifies it. I love that. What are some telltale signs that a dancer may benefit from with some Pilates rehabilitative exercises?
The two that I can think of offhand are recurrent injuries, and when young dancers in particular are given the note of you're always rolling through the arches of your feet. So with recurrent injuries, you shouldn't be getting the same injury over and over. That means as a dancer, you're putting extra stress on one tissue. You need to see a good physical therapist to do a good movement analysis and find out why. Why am I doing the same thing over and over? So that you can learn how to strengthen or stretch certain things to balance the body back out. I'd like to use the example of the rolling through the feet because I had two of those in my office this past fall. Two girls who were young and growing. Their abdominals were a little bit weak because they were going through rapid growth and development, and they were kind of hanging on the inside of their feet during their summer intensive programs, and then they came home with some nasty little tendinitises. We were able to reactivate their core and get them out of the feet, get them moving in a way that allows them to engage through their center and to use the feet appropriately, aligning them up, which is not only just a foot exercise, as we know, it also involves the right muscles of the hip and the center.
So what muscles commonly need to be strengthened in dancers in Pilates?
The powerhouse muscles, definitely. I say it over and over again. The upper abdominals, the lower abdominals, the obliques, which are essential for turns, particularly. I think of the attitude turn, needs the oblique muscles to be very, very strong. It also works the turnout muscles, the deep muscles in your back and your hips, to find and recruit them without engaging them to their maximum, because with dance in particular, it's very much an endurance sport, shall we say. Those muscles need to be turned on, they need to be utilized, but we don't want them gripping. So that takes time, and in particular, lying on the reformer and finding those muscles, just getting the weight off of the feet and finding them allows you to then engage them, get stronger appropriately without over recruiting them.
So it really is just retraining, because these habits can be formed for and be settled upon for years.
Absolutely, yes. Peeling away the layers and finding finding those things and for some people it's only a couple of things that just need to be engaged. Oh, just some awareness of this or that. For other people it's more extensive. With someone who comes in after having had a spine fracture and scoliosis, that's going to take longer than somebody who has a much more minor problem. It's only been a few weeks. That's going to be your quicker, oh, we're going to implement just a little bit of the Pilates curriculum into the injury. My spine person, that's going to take longer, and I'm going to use a lot more Pilates with them, as well as encouraging them to transition to finding a good Pilates instructor who they're going to be with on a long-term basis, so that that work will continue after their rehabilitation is done.
Oh, absolutely. Long term, that's important, especially to lengthen the career, if anything. Well, this is a great segue to the next question. We kind of covered this a little bit, but to prevent injuries, how often would you suggest a dancer do Pilates and why?
Well, as a general thing, I think it was Mark Morris who admits to still doing Pilates once a week, as he has for many, many years. I think that's a realistic number of times per week, particularly given rehearsal schedules and training schedules. And with my younger dancers, it also depends on where they are in their season. Obviously, it's now December, so everyone's going into Nutcracker. I don't think anybody is seeing their Pilates instructor while they were in extra rehearsals and performance time. But come January, they'll get back into their conditioning with their Pilates instructor and they'll boost it up, maybe have a few extra sessions until dance really resumes, later in January. But once a week is a lovely amount, because the Pilates is not being used as general conditioning. It's being used more just for alignment and control and working on the specifics of technique. So once a week is a lovely amount, but people do fluctuate. Sometimes they'll do more when they're off from dance for a little while. It is a good way also to do some general conditioning outside of the classroom or while they're rehabilitating. It's a good way to keep everything going as well. But once a week is wonderful. And I always recommend people get to know a good Pilates instructor and check in with them, throughout their career.
What do you recommend regarding access for a dancer to do? Because, all these dance classes and everything, they cost money. So what kind of recommendations do you give to them in order to afford and fit that in their schedule as well?
That's a great question. And that's one we always struggle with, since very few people win the lottery. Rats. But what one can do is I strongly recommend that you start with somebody privately to learn how to do Pilates. Then you can integrate a mat class when you know how to do the movement. Then you can get more out of the mat class. Just being in a large group, it's very, very difficult to work very specifically with one individual. So I always say, save your babysitting money. You just do now and again. Again, connect with a good instructor and be honest with them. I can't afford to come a lot, but can we work on mat together? If you have a gym that has a decent mat class, you can then have a private instructor teach you how to do the movements and do them well. So then you go to the class and the teacher will remind you of which, we'll call it combination. You're going to do what exercise is next. And then you can practice what you've learned in your private lesson and make a lot more out of it, so it can be more affordable that way. And we're very lucky in this day and age that now gyms do have group lessons, and it's become much more affordable. Some of them, it's even free as a part of the membership, which is terrific. But don't just do that. Go and have a few lessons when you can. Save your babysitting money and all of that. And, again, you spread it out over a lifetime and you'll get more out of the work
That's
when you
great
do it that
advice.
way.
That's going to be helpful for anyone who's trying to figure out. That's perfect. Thank you.
Exactly, because it's expensive, but it's less expensive than seeing an orthopedic surgeon. So on that
True.
perspective, Go see a Pilates instructor first.
Yes. So my favorite question now. So would you mind telling me your favorite story about treating a dancer?
I was thinking about that. That is a tricky one. I am so blessed to have a job that is wonderful, and I've got so many wonderful people that I've had the pleasure of working with. And truly, it's about these wonderful people. From one of my very young ones who did so much Pilates along her way, who became a professional dancer and is now a soloist in a major company. And I'm so proud of her. But the story that I think meant the most to me was a day when a mature dancer came for, and we were doing a lot of Pilates rehabilitation for his spine. He was in a Broadway show, and he had a daughter who was about 3 weeks old, and his wife and his baby came to therapy. And I have to say, it was one of the most pleasurable moments while I was working with Pilates with him on the reformer, I was holding his beautiful daughter in my arms, and I was so grateful because I know, he was entrusting his professional life to me, and to be honored with that and to be there with his family, it just really reminded me how important it is, and also how wonderful. Um, it was a wonderful moment by my reformer. That's the best I can say. As you can tell, words are kind of fading away, but
Oh,
it was lovely.
absolutely. Nobody can see us because both right now, Sigrid and I are just smiling at each other because this is just such a heartfelt story. Thank you so much for sharing that. Well, we have reached the end of our podcast. So thank you so much, Sigrid. And thank you to our listeners for joining me for another episode of Physiotherapy Performance Perspectives. Join me on the first Monday of every month for the next episode. To hear more episodes, click on the link in the description below to view the website. Like us on Facebook at facebook.com/PT Performance Perspectives to stay informed. And finally, if you want to get in touch, email me at ptperformanceperspectives@gmail.com. Thank you so much. Bye.